Welcome everyone to the April 12th, 2021 meeting of CB11's Human Services Committee. My name is Nye Whitaker and I'm the chair of the committee. I would like to call this meeting to order. It looks like it's 6:04 on my clock. Tonight we're joined by our community associate, Marlene Pierre, who is the staff liaison. And Marlene, I didn't know if I should read these ground rules yet, or if you want to go ahead and start with attendance before I move into all of the order and parameters for tonight.
Right, so the ground rules go first, and then on the next slide, just as it's written down.
Perfect.
Is when you go into, I'll do the roll call.
Great.
So if are you comfortable with saying the ground rules?
Yeah, I always thought you guys in the past had done them, so that's why I was just double checking. So on the script, it doesn't say who should be saying what at this time. When I do my scripts for work, I always put little parentheses so I know who's speaking when. So to go over some of the ground rules that have been set by Community Board 11, I'm going to change the wording a little bit, Lee, to make it more less frightening. So we do ask that everyone who's participating, whether you are a member of this committee, a member of our larger CB11 board, or a member of the public, we ask that you please refrain from speaking until you are acknowledged by myself, the chair, and or our community liaison, Marlene Pierre. So if you're a CB11 member and you have a question about board business or wish to make a motion, I ask that you please raise your hand using the function, raise your hand function on Zoom. If you click the participants icon, again, depending on your computer system, it may be in the bottom across the menu or on the menu at the top or right. If you click your name at the participants panel, there will be an option to raise your hand. Click on the raise hand function. If you still have any technical difficulties, you may click the chat icon to relay that you're having a difficulty to the staff member, and at that time, Marlene will acknowledge you. The chat function overall, however, will not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to technical difficulties that you are having so that you can state that in writing, and for sharing information if you are from an organization, like your email address, name of the organization, phone number, or location. So that it can be recorded. You should also plan to state that out loud on the recording during the meeting. Please keep your questions and comments as succinct as possible and germane to the discussion so that we can stay on message and on schedule. Members of the public, if you have a question or comment about the subjects in the agenda, you are also asked to please raise your hand through the Zoom raised hand function and wait to be recognized. We will not be recognizing questions or comments from the chat otherwise. Oh, so now we get to the agenda. Thank you, Marlene. So returning to what was stated previously, I would like to call the meeting to order. And so we will now take a roll call attendance for the committee. So board members, you're welcome to unmute yourselves, and when your name is called, to please mark yourself as present or state yourself as being present. So I'm going to turn this over to Marlene for this next part of the agenda.
Thank you, Nye. Eva Chan. Thank you. Wendy Ferrara. Osendi Garcia. Osendi Garcia.
Present.
Thank you. Patricia Martin.
Here.
Thank you. Jennifer Meyer. Jennifer Meyer. Arturo Perez.
Present.
Thank you. Xavier Santiago.
Present.
Thank you. Isaac Scott. Isaac Scott. Robin Strachan.
Present.
Thank you. And Nye Whitaker.
Present.
Thank you.
So it looks like we have a quorum and we can move forward.
Yes.
Okay. So I'd like to then move to the adoption of the agenda for this evening. The agenda has been posted on the CB11 website and distributed ahead of time by the board office. If there's no objection, we will adopt the agenda as stated. Committee members, if you object to adopting the agenda, you may raise your hand through Zoom and wait to be recognized. So I will give it a moment to see if there's any objections to the agenda.
I see a raised hand by Robin.
Sure, if you can please acknowledge them.
I just moved to adopt the agenda.
Great. So seeing that there are no objections, I'm going to recognize Robin's motion to adopt the agenda. Is there a second?
I second.
So I heard a second by Pat Martin. All in favor? Can it be a all in favor vote? Or does it need
Yes.
to be? Okay, so all in favor of adopting the agenda, please say aye.
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 Any abstentions? And we already addressed any objections. So it looks like the motion passes. We'll move forward to an adoption of the March committee minutes. First, I'm going to ask if there are any objections.
No.
Okay, then I'm going to ask for a motion to adopt the March committee minutes. Do you see any raised hands, Marlene? I can't see them on my screen for some reason.
I see a raised hand by Robin Stration.
Robin, recognizing you.
Thank you. I move to adopt the committee minutes of March.
Thank you. Is there a second?
I see a raised hand by Osendi Garcia.
Okay, Osendi.
I second the motion to adopt March minutes.
Great. As there were no objections, all in favor, if you can please say aye.
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 Are there any abstentions? Okay, it seems like that motion passes as well. I'm going to ask Marlene to advance to the next slide. Okay, so it looks like there are announcements. So I'm going to ask first the committee members if they can raise their hand, just so that you know we're going to keep announcements very brief in order to stay on schedule. So please raise your hand to be recognized if you have an announcement. Marlene, do you see anyone?
I don't see any raised hands from the committee or the, well, sorry, Robin just.
Robin, I'm going to acknowledge you.
Thank you very much, Chair. April 23rd, Search and Care, my nonprofit, is having a Zoom workshop, which can be joined by using your computer or your phone with Dr. Luba, who is the geriatric pharmacist from Uptown Care Pharmacy on 116th Street. The topic is, once we're all vaccinated, now what do we do? So I'll share that info in the chat.
Great, thank you so much.
Mhm.
Is there anyone else with a raised hand?
I don't see a raised hand from the committee or the public.
Okay.
Are you ready to move on or?
Yep, I am ready to move on to the informational updates.
Sure.
Before we get started, I'm also just going to recognize our Assemblyman Robert Rodriguez, Union Settlement, Barican, and others who rallied, including members of our CB11 leadership, to make sure that vaccine distribution was brought to a site here in East Harlem. And I am happy to report that over the weekend, Taino Towers was opened as a site on Saturday and Sunday, and it was great. I was there briefly to see so many members of our community there getting vaccinated. So I want to thank Xavier, who attended the press conference on our behalf, and just as I said, others from our community who stepped up to make sure that East Harlem was vaccinated and continues to stay healthy. And now I'm going to go ahead and turn the floor over to our first informational updates. I'm recognizing Padmore John from the Harlem Neighborhood Health Action Center and Lorraine Valentine from the Test and Trace, who's the Manhattan Borough Outreach Director, to see which, if any, is available. And actually, excuse me for one moment, I do see Arturo Perez's hand raised, excuse me, and I'm going to acknowledge him if he wants to speak further about the vaccine site. Arturo, is that why you're raising your hand?
Yes.
Please, the floor is yours. I'll give you briefly just 2 minutes to add to that informational update that I just gave.
Yeah, that's absolutely correct. Taino vaccine site is open, and it was open this Saturday with the help of the Department of Health and Somos Community Health Center. But I want to emphasize that we're also vaccinating at Taino Gymnasium Monday, Wednesday, and Friday, 9 to 5 or 9 to 7. And that's open for all the Taino residents, and it's going beyond Taino residents to the East Harlem community and all the public housing in the surrounding area and all residents of East Harlem. So Monday, Wednesday, and Friday, and we're doing that with Puerto Rican Neighborhood Health Center. I am the CEO of the East Harlem Council Puerto Rican Neighborhood Health Center, and I just wanted to add to the vaccine efforts that's happening in East Harlem.
Thank you, Arturo. I figured that was why you were raising your hand, and so I appreciate you adding on to that report. Also, just want to make sure to remind everyone that we have a standing invitation from the Human Services Committee to the Department of Health and Mental Hygiene, the Test and Trace Unit, and New York Health and Hospitals. And so this is their monthly update. So just to kind of get back on schedule, acknowledging Padmore and Lorraine.
Hi, this is not Padmore. This is Jaime Gutierrez. I work really closely with
Hi, Jaime. How are you? Welcome.
Thank you. Thank you. I'll be brief. As you all know, the site at 115th and Lexington is a vaccination site. We are providing the Moderna shot. We are currently in second dose land, which essentially means we are not giving first doses for the remainder of the month of April. But we will start with first shots in May. In the meantime, while we're in this second dose land, we have some allocated allotments of Johnson & Johnson vaccines out of the Ford Foundation for Harlem residents that come to us and let us know that they're interested in a vaccine. So we're working out some transportation things to that end, but it's already kind of up and running. And so if someone does come into the building and expresses interest in the first shot, we let them know that we can send them to the Johnson & Johnson site and get them scheduled. I think the only other thing that we did hit a pretty significant milestone last week as the Action Center distribution site. We vaccinated 200,000 people out of the East Harlem Action Center. So, celebrate your small wins or big wins, I guess. And I think that's it. I don't know how much Padmore updates, so I'm gonna keep it there. And if you guys have any questions, I'm happy to answer.
Is Lorraine on? I didn't know if I heard again, I'm sorry, there's some little bit of noise in the background here. Marlene, is Lorraine on?
I don't see Lorraine.
Okay.
Just one more time.
Sorry if you guys hear kids playing.
I'll look to see if she's hanging out in the attendees.
Okay. I do then just want to take a moment. I know this is not necessarily in East Harlem, but it's adjacent to East Harlem. This week, the Test and Trace unit is focused. And I know that this also might be part of the borough president's update when her team joins. But this week, and actually for the rest of this month, the Test and Trace unit is going to be working and focused on making sure that we test and get vaccinated members of our restaurant workers community. So they will be setting up a new vaccine bus. You guys may have heard about it over the weekend. It was announced, it's been traveling all over the city, but they will be doing restaurant workers in Harlem from Tuesday through Thursday. One of the first sites, as I said, adjacent to our neighborhood will be at a restaurant called Field Trip, located between 115th and 116th on Lenox Avenue, on the CB10 side of the street. And so I just want to make sure that people know that they can sign up for that, and that the bus will be there. That bus will be traveling across the city. And also just want to remind people that on the corner of 125th and Park Avenue on Wednesdays, when Uptown Grand Central is there is a testing facility every week for COVID-19. So if you are someone who works in the community or has been exposed or maybe have been traveling, in addition to the East Harlem Health Action Center, you can go to the 125th Street site to get tested, and to the 115th Street site if you're a restaurant worker this week to get vaccinated, in addition to the others that exist in our community. So I'm going to go ahead and see if there are any questions really quickly before I move on, because I did see some hands raised. Marlene, was there any hands raised with questions about the vaccination and or testing?
No, I don't see any hands raised. I don't see Lorraine in the attendees as well.
Okay.
I see Noel Ali say his hand is not raised, so I'm not sure if you want to recognize him.
Yeah, Noel, are you here on behalf of New York Health and Hospitals Metropolitan? I know I usually allow you a few moments during this section to give an update as well.
Hi, can you hear me?
Yes.
Hi. I can't report for test and trace, but I can tell you, we continue to do testing at Metropolitan. Our annex open on 97th Street between 1st and 2nd, 7 days a week, from 9 to 3:30. We're still doing a lot of testing there. It increased around Easter, but the center's open every day. We also continue to provide a vaccination by appointment that in our vaccine center on site. That's also very busy. And we continue to encourage people to come in for their appointments and make their appointment to see their primary care providers and keep up with their other health issues as normal. I don't have anything specific else to announce, but just wanted to join in the meeting today. Thank you.
Thank you so much, Noel. We appreciate it. Please feel free to drop any other information or contact websites into the chat. Since there's nothing else, I'm going to move on to Easy Living Home Care of New York. It says Felix Slepisky. I'm so sorry if I'm not pronouncing your name properly. Felix Slepisky. Okay. Thank you, Felix.
Yes, hi, how are you?
Good.
Okay, thank you for opportunity to present our agency to the board. Sorry about it. And we're at a home care agency located in Brooklyn, and we service 5 boroughs and Long Island. And we will dual license. We're CDPAP and Elixa. So CDPAP was our first approved license. That's for consumer direct personal assistance program. That means that relatives, friends can take care of their loved ones, and so they don't have to rely on outside caregivers. And in 2017, we got the license for Elixa, so this way we can provide caregivers, and who is employed with our agency. And we would like to community board to allow us to be included in a resource directory. So this way people can call us and we can explain them, because of our services, which is, I think it's a very beneficial, especially in the times like right now, and because of COVID-19, so a lot of people they're staying home, and they're not allowed, outsiders, to take care of them. So we can provide that service, So that's basically it, So we've been raising, some money, for local communities, and we educate our local communities. So we do some events in Brooklyn and in Harlem also. That was prior COVID-19, so maybe A few of you know us, our name, because we were advertised, and that's basically it, So if you have any questions, rather answer those questions, so this way, you'll be more, knowledgeable in our services.
Thank you so much. I'm going to ask the committee members if you could please raise your hand if you're a member of the committee and have a question regarding the Easy Living Home Care of New York. I don't see any hands raised from the general public. Is there any questions? So I see 2 participants with hands raised.
Nye, Xavier, and Cindy have their hand raised.
Great. Marlene, can I ask you to call on them in whichever order you saw them first, because it's not showing on my screen?
It's fine. Xavier was first.
Thank you.
Hi, I just wanted to say thank you, Felix. I know you've been trying to come before the board for a little bit, and thank you for your patience, and
yes, thanks.
Everyone here who is attending and been updating. So I just want to say thank you for being part of the solution. We look forward to disseminating this information, and also to when it comes to our site over at Taino Towers, I want to thank everyone involved with that. We've been begging and pleading, just like when we were asking for testing. So again, thank you for the persistence, the doggedness, and yeah, we look forward to creating good partnerships. So there was more of a statement. Thank you, Nye. Appreciate it.
Thank you.
Thank you for allowing us
Osendi.
to include in the meeting. Thank you.
Thank you. Osendi.
Yes, hi.
Hello.
Thank you so much for your presentation, Mr. Slepetsky.
Yes.
Excellent. Yes, I hope I did it justice. I wanted to ask, I've heard of all the wonderful work that you've been doing and all the support that you've been providing. Would you mind sharing a little bit about the support that you're providing your employees through this challenging time? Are they receiving additional support, additional care in order to be taken care of while they're assisting people who are having very difficult time?
You know what, we provide them with all this PPP, the gloves and all this protection material, whatever they need, because a lot of them, they stay home, they do not going out. So that's what we do. And we're offering them, vaccination sites if they need it, so we can even drive them there. Sometimes they don't like to take a public transportation, so if they need it, they can call us and we arrange the transportation so that at least they can be vaccinated, so. And whatever CDC guide, we just follow all the CDC guidance, for our employees, and in terms of testing and in terms of vaccination and education of our employees. So that's basically, so whatever they need, we provide them with no limitations. So.
Excellent. Thank you so much for.
Yeah, we actually even we have a contract with the facility that they do assessments over the phone, so it's a tele-assessment, so nurses don't have to go there, so because of all this COVID-19 situation. So we try as much as possible. We haven't been prepared for that, but we're adjusting on the way, so we're trying.
Well, we really appreciate all the effort that you've put forth, especially because you're taking care of so many vulnerable people. This pandemic has definitely been challenging. So again, thank you for all of your work.
Thank you.
Thank you. I'm going to ask Marlene to please move on to the next slide. So presentations and discussions, it looks like the first one up that we have is the Volunteers of America Schwartz Assessment Shelter. We have several representatives. I just want to let you all know there's a hefty list of presenters, that the time is the time, and that time should allow for a few questions. So I just want to make sure for all of those that are listed, are you all speaking, or is just one person speaking on behalf of the SAS Center? So could someone please clarify for me? Alavro, are you on?
Yes, hi, good evening. Yes, I will be presenting, and Ms. Thomas, who is here, she will do a little segment. We will not take more than 10 minutes.
Okay,
something.
great. Just want to make sure we stay on time. So the floor is yours.
Thank you very much. So my name is Alvaro Salas. I am Director of Programs at Schwartz Assessment Shelter, located in Wards Island. Ms. Mackey is Jenny Mackey, who is here, and Ms. Jean Thomas. Both of them, they are Directors of Social Services. And the Armstrong, who is Associate of Vice President for Volunteers of America, Greater New York. Thank you very much for allowing us to present Volunteers of America to you. And so with that said, Ms. Mackey, can you share? Thank you. Sorry, we have a little presentation there. So Volunteers of America has been around for 125 years now. Was founded here in the city of New York. And sorry, thank you, Ms. Mackey. Was organization, the name comes because it was funded with volunteers. 125 years later, we are with approximately 80 programs in New York and New Jersey, and around 1,300 professional staff. If we can move to the other one, please. Then Volunteers of America has different programs, including one of the main goals of Volunteers of America is addressing the causes of homelessness. We provide services for shelters and supporting housing, as well as SROs. We provide shelters for family, individuals, as well. We provide shelters for veterans, people living with HIV and AIDS, services for people with development disabilities. We have domestic violence shelters, and as well, we address situations with the elderly, as well with SROs and programs with aging at home. Specifically, Schwartz is, Ms. Mackey, please, thank you. So Schwartz Assessment Shelter is located in Wards Island. Volunteers of America have been managed the shelter since 1984. And it's a shelter of 335 beds, single man. We provide 3 meals a day, breakfast, lunch, and dinner. Healthy snacks in between meals for people that have any medical condition. We as well have laundry in the premises. We offer vocational services, employment services, and as well housing services. And we will talk more about in detail about the services that we provide to the clients. We have approximately 75 staff, and it's 24 hours, 7 days a week. Ms. Mackey? So like we were saying, some of the services that we offer is housing, education, employment, and advocacy. We try to connect the clients with the services that they need. And as well, in the community, to be sure that they're ready to go back, as independent living, if that is the case. Just as homeless singles adults enter DHS shelter system for different reasons, and they stay in the shelter different periods of time, our clients normally stayed at Schwartz around 3 to 6 weeks. That is, we're an assessment shelter, so we're not the final destination for the clients. And even as we engage all the individuals, as we know, some clients are harder to engage than other ones. So we have taken this fact into consideration, and we have created options to give those clients who are hard to reach, more choices. It's our intent to offer and engage clients from a personal centered perspective. That means we're trying to meet the clients where they are. Now, a little bit more of the services. Ms. Thomas is going to be talking. Ms. Thomas is a licensed social worker. And like I said, she's one of our directors of social services at Schwartz.
Thank you, Mr. Salas. As Mr. Salas mentioned, we serve a huge population. And so all of our clients are different, right? And so part of what we do is assess their needs and see what exactly it is that they need. For example, if a client comes to our shelter and they don't have public assistance, then we make sure that they're linked to public assistance. We help them with that process. Or if they need to be linked to a primary care doctor or even other medical services, we make sure that, we make referrals and we make sure that they're linked to that. If they need to be referred to substance treatment programs, we know exactly who to call, and they'll even pick up the clients on the same day, because we have that kind of relationship with the service providers that we have affiliation agreements with. We have even on-site contractors for medical services, and even mental health services, because that, especially among this population, there are many needs that we need to meet. And especially with the pandemic that we're dealing with now, telehealth has been such a big, it's been huge, and it's saved us, because a lot of our clients as medical providers or mental health service providers have restrictions in their sites, and so they haven't been able to meet them. And so with the telehealth services, with one of our even affiliations, they've been able to meet with them and have their medications refilled, and all the things that they were able to meet with them for. And we've been having telehealth since last May. We've even set up services with the barber where our clients are actually able to go to the barber and get their haircuts. We even have a podiatrist who actually comes on site weekly to provide services, especially to maintain good physical hygiene and all that. We're even linked to community hospitals, especially we have a really good established relationship with Metropolitan Hospital. And just to give you kind of like a better idea of what of the extra stuff that our staff go through, we also conduct group workshops. And some of the group workshops that we conduct on site are health education, smoking cessation, medication management, housing readiness, relapse and prevention, mental health awareness, medication management, anger management, and conflict resolution, job readiness, money management, accessing community resources. We cover all those topics, and there's so much information and tools that we provide our clients with, in the hopes of kind of building a good foundation of support for them for their growth. And that's kind of why we have built good relationship with these service providers, because in this community, because we know that communal support and teamwork will only strengthen that opportunity for their growth and success. Mr. Salas?
Thank you. I see there was a question about if we assist clients to...
I'm so sorry, Mr. Salas. We don't answer questions from the chat. So if you want to please use your time for the presentation, I will then, when the presentation is over, recognize questions from the members of the committee and then from the general public. Thank you.
Thank you. My apologies for...
Okay, just want you to use your time wisely.
COVID-19, right? As Ms. Thomas was mentioning, it has been very challenging for us as well, addressing social distancing, wearing masks. We were very well prepared. I mean, just to tell you, make a little light, comment. If you were concerned about getting toilet paper for your family in the beginning of the pandemic, picture trying to get toilet paper for, 500 people, trying to get that for like 3 months supply of toilet paper in the middle of a toilet crisis. We have managed that. We were aware to have masks, have gloves, hand sanitizer, addressing, we need to modify the space in the shelter. We need to modify the schedule of the meals in order to facilitate the spacing for the clients. We have daily on-site and off-site COVID testing. As well, we have twice a month on-site vaccination. And as well, thanks to our partners and the community partners, we can offer vaccination as well, pretty much off-site every single day. At this point, we have 45% of our staff and clients that have been vaccinated. Glad to announce that we have not lost any client or staff due to COVID. And it has been very successful, we have been very successful in maintaining the health, not just physical, but as well mental health, or of clients and staff. now lasting solutions. Again, this, as we continue to see the increasing numbers of homeless in our communities, Volunteers of America believes the solution is a combination of increasing the number of affordable housing opportunities while teaching single adults life-sustaining skills. Obtaining vocational and social skills can lead to employment opportunities. Employment programs and work support remains a cornerstone of DHS efforts to help clients to move out of shelter and into permanent housing. Our housing placements numbers, even during this pandemic, are still strong and growing. We place around 20 to 30 clients monthly into supporting housing or independent living. So we assist clients filling up to define where is the best option that they have for housing. If that will be supporting housing, if that would be independent living, if they can apply for CDFEPs, if they can apply for any other incentives, if they have Section A, if they're veterans. We explore all the options for housing for the clients. Ms. Mackey? So just to conclude, there is my information, this is my email address. Please feel free to send any questions or any comments. And with that said, before finishing, any of my colleagues of Volunteers of America, do you have anything to add? So thank you very much for your time, and we're open for questions.
Great. Thank you so much. I saw a few questions in the chat. I do want to remind everyone that our protocol is for you to please raise your hands and wait to be acknowledged. We take questions first from our committee members and board members, and then from the general public. So if you did have a question in the chat, please don't think we're ignoring you. We're just waiting for you to raise your hand. So I'm going to ask Marlene first, if she could please acknowledge anyone who is a member of our committee who has their hands raised in whatever order they appeared.
Sure, I don't see any hands raised from committee members nor attendees. Oh, one person, Cindy just raised her hand.
Okay, so I'm going to recognize Osendi, and then Marlene, if you could just queue up right after Osendi, I will be calling on you for the members of the public. I will say that there is a request about, I just want to make sure we're being inclusive. There was a request about closed captioning services. So I just want to raise that, Marlene, from the chat and elevate it. I'm not sure if that's something that we can do mid-cycle, mid-committee meeting, but I did want to acknowledge that there was a request for that.
Yeah, it's something that I'll have to have set up when I set up the meeting. So moving forward, I'll speak to Angel about that.
Okay, thank you so much.
No problem.
And we apologize to anyone who's inconvenienced by that. The recording, though, will be available afterwards, as well as the minutes. And we are always invite you to contact our staff office if there's any questions about tonight's meetings. We want to make sure they are as inclusive as possible. Cindy, the floor is yours.
Thank you so much, Nye. Good evening, Mr. Salas. Thank you so much for the presentation. I have two questions. First one, what are your outreach efforts outside of the facility? I know a lot of individuals, a lot of transient individuals who use your services, congregate along 125th Street. Are you providing any additional services in order to address what happens after they leave your location? And also, are you addressing any technical issues that those that are seeking your services may have in order to actually continue telehealth services? For example, are you providing them support in actually getting the technology needed in order to continue accessing the telehealth services?
Right. So excellent questions. And yes, one of the services that we do, we have a connection with free phone services, right? And they come to on-site and providing phones to the clients, right? The other one as well is we try to connect the clients, for instance, with some river. Our partnership used to be called, Bright Point, but now they have moved to some river. I don't know if that rings any bells. So we as well connect them because the idea is for our clients to be independent in the community. when they're ready. So they don't depend, right, of the DHS services or the services that we have in location. So we encourage and we as well train the clients how to manage, and is necessary the case to install, a Zoom or any other way of communication through their phones, if that is the case. And as well, through our community partners, they will provide the services in the community, and they have post, like I said, Brightpoint, they have some river, they have a mobile unit that goes around as well, and they provide telemedicine through that mobile clinic. For the clients on 125th Street, we are aware of the situation. We have a staff doing rounds around 125th Street, just to be sure that we can engage the clients if there's any issue, any situation. So we do that in multiple times during the daytime.
It's certain clients who also need that extra support, because we cannot control what our clients might be doing or where they might be going, right? We also make sure to make referrals to ACT teams and SPOA referrals, so that we also have those teams also reaching out and doing outreach with the clients as well.
Mm-hmm. Thank you.
Would you please be so kind and share either the contact information or flyers to these events if the community would like to get involved, to actually be able to provide additional support to your organization, as well as to support the efforts of this community board and additional community leaders in the community? I believe that we could definitely uplift those in need and the needs of our community by doing so.
Leslie, I see that you want to say something.
Yes, we also have a program with that functions within Schwartz. It's called KEEP. It's Community Engagement Employment Program. And that program is a group of case managers and has a program coordinator that assists the client from admission to the facility. And the services extend beyond discharge. So 6 months after discharge, we track the client's progress in the community to help them if they have any minor setbacks, if they need to access services, if they need referrals. So our services are not just on site, but we try to follow the client post-discharge as well.
Excellent.
Housing retention, that is one as well of the services that we provide. Once the client, we know that, we're trying to prevent people to be part of the cycle of being homeless. So once if they have reached housing, any type of housing, independent or supporting housing, we try to be sure that they are not, for whatever reasons, becoming homeless again.
Okay, excellent. Thank you so much for your time. I really appreciate it.
Sorry, Chua, yes, I see Ms. Chan has the hand up. I don't know if I am allowed to take control of and ask Ms. Chan, do you have a question?
Yes. My question is, how many of your clients are from Harlem? Do you keep track of this type of statistics?
Right. What happens is, we are connected to the Department of Homeless Services. So they do the referrals we're an assessment shelter, right? We are part of a series of assessment shelters located in different parts of the city. So pretty much, the client goes to the intake assessment, pretty much 30th Street, right, next to the Bellevue Hospital, and they will do the referrals to us. So the clients are coming from everywhere, right? I mean, like not just New York City, but the country in general, right? I mean, we have people as well coming from other parts of the world that they find themselves in New York with no other housing opportunity. So we have multiple clients from everywhere. So keeping statistics, if the clients are coming from Schwartz, from East Harlem, it's really, we could not say how many people would be there, because they could end it in Brooklyn, right? When they apply for shelter.
Right, so I think related to that, if many of your clients are not from Harlem, then my follow-up question is then, if they, based on the current transportation, right, they tend to congregate on 125th Street, then basically it creates quality of life issue on the street for Harlem residents, surfacing vulnerable population from different parts of the world in the US. So my question is, do we have any plans on improving transportation options for the residents in your housing unit?
So Ms. Chen, thank you for that follow-up question. There's also a bus that comes on to Woods Island that's provided by the MTA, and the clients have access to use that bus to get off of the island. In addition, we have staff 24 hours, 7 days a week that roves from the island to 125th Street. And we specifically target the train stations along the entire length of 125th Street. We also have the community engagement and employment staff that also go out into community, and they will walk the perimeters to see if we have clients that are congregating, to redirect them. We also give our clients Metro cards so that they can get to and from their appointments. While we're not able to select our clients that come to Schwartz, it is an assessment center, and the Department of Homeless Services assigns the clients to our facility based on need and based on previous history at the site itself, because the thinking is that if the client went AWOL, or if the client left our facility and returned for assistance, returning them to us, we already will be familiar with the case and be able to service the client to pick up the service needs. Our staff also provide services to escort clients that seem to have difficulty with transportation or may have difficulty navigating in the community. We transport them to and from appointments. We are aware of the concern, and we want to partner with the community. If for any reason there are any concerns that anyone in the community has, you can email Alvaro, and we will address this to the best of our ability. We also have on site the DHS police, and we also partner with the community affair officers as well in the community.
Thank you so much. Thank you very much. Yeah, I just want to make sure that we have time to get to everybody. So thank you, Eva. I know you had a question and a follow-up question, so I want to make sure we stay on time for the rest of our presentations. Alvaro has put his email and information there, and I think it's important that we stay in touch with this group. I do have a question, which is, and you may have said this, I apologize, I said earlier, I have some noisy neighbor kids in the back. I had to call downstairs and ask the doorman if he could have the kids just quiet down a little bit, so please forgive me. Delicate balance in the middle of a pandemic, because I know that they just wish they could be out playing somewhere. You might have said this already, but one of my questions was just, what is the average stay or visit of someone during that assessment period? I don't know if you've said that, but if you could just let me know that, and I apologize if you're repeating again.
Yeah, no problem. Around like three weeks would be kind of like the minimum that stayed. We have like 21 days. DHS has 21 days limit, but that get expanded as the needs of the clients, okay, right? And for the next move, wherever that will be, okay, right? Assignment to a different location or housing. So some of the clients, they stayed with us, like 6 weeks. So the media, we stayed for like 30 days. That is okay. What we.
That's the average. Okay. So I know that this topic is very near and dear to everyone's hearts here. So I just want to say thank you. If you have any other questions, I ask that you direct them to Alvaro. He's put his email, it's on the screen. He's also going to drop all the contact information for himself and Leslie and the others into the chat, so that we can stay informed. We thank you for coming to present, and we want to make sure that we build better relationships with all of our service providers on the island so that we can work in partnership to improve our community and the quality of life for all who live here as well as visit here for services. I want to acknowledge that Lorraine Valentine is here with us. She was actually on the agenda earlier. Oh, wait, excuse me. Marlene, in regards to their letter of support, is there anything else we need to do or say at this time before I go to Lorraine, because I know she's calling in from the field?
Yes, you have to, someone needs to make a motion and then second it and have a discussion and then go, the committee will go to a vote. But if you want to just close that out and then go to Lorraine, like how soon does she have to leave? Does she have to leave like right now,
Yeah,
right
like
now?
Padmore, we just lost already and he was on for a few minutes. So I just don't want to lose them while they're out in the field. So I'm going to pause just for 1 second because I think that this is going to be a lengthier discussion and it won't be something that's going to be done in a few minutes. So if you don't, if everyone can pause for just 1 second, I am going to call on Lorraine. Padmore was on and he had to leave. They are out at a vaccination site. Otherwise I wouldn't interrupt us, but they're doing this important work. Lorraine, are you still with us?
I see Lorraine, she can unmute herself.
Okay, Lorraine, we're ready for you. I think Padmore had to jump. I'm just texting them real quick. Please stand by for 1 moment to the team from the SAS Center, because I do believe yours is going to be a very lengthy discussion. Okay, I'm going to give it just another moment. I believe Padmore John put all his information into the chat. So if anyone is interested in more information from the East Harlem Health Action Center, or Padmore sits on the vaccine task force and has information, we can share that with everyone.
Lorraine is off of mute and her camera is off as well. I'm not sure if she's having audio issues.
Okay.
Because she's not on mute. Yeah, oh yeah, she's having some issues.
She's connecting her headset. If we could just give her 1 moment for a really brief update. For everyone that is here, we will, after this quick update on test and trace, because we're very concerned about making sure our neighbors here in East Harlem get vaccinated. We heard from the report that the gentleman gave from the Harlem Neighborhood Health Action Center that they're only doing 2nd doses. We heard that Taino Towers opened up as a site this weekend, and we'll also be doing testing. It looks like, vaccines 3 days a week, but we just want to have an update where else outside of Boriken and Metropolitan that people can go to get services. And if there's any other pop-ups here. Otherwise, we can always have Lorraine email us. Yeah, wait, we heard you for a moment.
Yep, can you hear me now?
Yes.
Great. Can you just give me the ability to share my screen? Awesome. Okay, sharing. Okay, good evening, everyone. I'm so sorry. We're still working on those audio issues. Thank you, Nye. I've been out in the field all morning. We opened a new vaccine site in Times Square, but we have some more exciting news for Upper Manhattan. And so I'm glad to be here, and I'll just, forgive me all, I'll speed right through this. I'm gonna be focusing on vaccine information, and we'll just get right into this. These are the current cases and percent positivity rates. We always wanna make sure that folks can see where we're at currently in the entire city of New York. Just to remind folks, the grayscale probable causes are the antigen testing there. That has been a new feature. This is the Manhattan data from as of last week. So just to see where we were in January versus where we're at now, beginning of April in Manhattan citywide with our percent positivity data. So we've dropped down about 3%, which is great news. However, we all knew that there is another variant floating around there. So that's why vaccination is crucial just as much as testing is important. Here are just a peek at what our outreach efforts in Manhattan were this last week of Manhattan. And I just got approval to share with our Manhattan calendar. So we'll send that after, we'll send that along. I'm just waiting for one more piece of information. But just to give you an example, tomorrow is Ramadan, the beginning of Ramadan. And so we'll be doing our Get Tested Tuesday kickoff on 115 with Imam Konote at the mosque Masjid Aqsa there on East 115 across the street from Lehman and King Towers. So folks can come on down because we'll be testing. And I just found out Saturday night that we'll be doing a mobile vaccine unit for the restaurant workers. We've been connected in partnership with Roar there. And although folks from the community will see the vaccine truck, those appointments have been filled, but I'll be there on site with our amazing Canvas team to set up appointments for folks who are interested in vaccine appointments. If they're not NYCHA residents, we have some amazing news. If you are NYCHA and you're in the Johnson Houses area or St. Nicholas Houses area and you need a vaccine appointment and you're a NYCHA resident, you can just walk right in. Also, our vaccine sites, 75 and older, because our seniors are a priority, and we understand that there's a technological divide overall, but especially for our seniors, they can walk into vaccine sites, especially if they're a city site, and get vaccinated. And anyone accompanying them can get vaccinated as well. So we have some updates on our face covering guidelines, and I've shared this presentation with Marlene, who can circulate this. And by all means, please use this to help disseminate information into the community as well. This is our new campaign marketing pitch right here. Is Lady Liberty with her vaccination. We're really excited to hopefully reach herd immunity and get 80 to 85% of the city vaccinated so that we can all still practice the 4 core, but at some point, if we reach 80 to 85%, we can walk around without masks. And so here we are with the vaccine numbers in regards to vaccinations administered all over the country. But specifically in New York City here, we have over close to 5 million vaccinations, total doses, and fully vaccinated, close to 2 million fully vaccinated New Yorkers. So 1,911 and 83 folks have been received second doses. And when the Johnson & Johnson has been available, they've received that as well. On here, and this is something that we want to work on, I will give you the number for the zip code for East Harlem. We have 10029. We have 27% of our community members who have been fully vaccinated. It sounds great, but we still have a lot of work to do. And we need to make sure that folks have access to vaccinations. So we really want to make sure that when we're talking about vaccinations, that we stay on topic with equity, access, and distributions of vaccinations as well. So it's really crucial for us to see the breakdown by ethnicity and race here. We still have a lot of work to do in regards to our folks who in the Asian, Latino, and Black community. We want to work with our trusted gatekeepers in our community to help increase vaccine education here. The numbers are low. We have about 13 to 21% of folks who have, 13% who have been fully vaccinated, 21% who have at least had 1 dose in the Black community. In the Latino community, we have 23% who have had at least 1 dose and 13% fully vaccinated. And that's overall citywide. As I said, for East Harlem, specifically in the 10029 zip code, we have a 27% vaccination rate here. As you know, we're focused on equitable distribution, including acknowledging the history of current experiences of racism and bias in healthcare and communities significantly impacted in COVID-19. We're driven by partnerships with the federal and state governments, community elected city agencies, and sector partners to increase vaccination education. As just a reminder that vaccinations is led by the Vaccine Command Center. It's an interagency operation between the New York City Health Department, Health and Hospitals, Test and Trace Corps, the New York City Emergency Management, and other city agencies as well. The vaccine basics that we should all know and are aware of is that they're safe, they're recommended, They do not contain a strand of the virus, and they do not alter the DNA. The 3 vaccines currently that have been approved by the FDA for emergency use and authorization is the Pfizer, Moderna, and Johnson & Johnson. And the Johnson & Johnson is an adenovirus vector vaccine and requires only 1 dose. And that is what will be administered out of these mobile vaccine trucks, the mobile vaccine truck that will be on site in East Harlem starting tomorrow. So how do vaccines get to New York City? The federal government manages distribution of all vaccines from the manufacturers, states, and localities. New York City receives an allocation proportionate to its population. And so we're finally starting to get as many as that were promised from inauguration day, thanks to the Biden and Harris administration, and they keep coming, and they're starting to increase even more so. So we're really excited about that. As you know, we're now starting to vaccinate folks who are 16 and older, which is why it's incredibly important for us to continue to still focus on seniors. I just wanted folks to know that I also send Marlene and I kicked up a site for homebound seniors. And this is what the mobile vaccine truck will also be used for, so that we can administer the Johnson & Johnson. There's a link on there. It works. It's real. You type somebody's name, you put in their phone number. So if it's your neighbor, if it's your auntie, if it's your abuela, put their name in there. If they can't come out, we'll make sure that someone calls them and they get vaccinated. You all know how to get in touch with the health committee chair, Ms. Nye Whitaker, who knows how to get in touch with me if you haven't gotten a response in 72 hours to a week, and they'll escalate it. And then enhancing access and building confidence. And this is where we all need to really link arms and work together here. I would say, yes, we still have the challenge of vaccine hesitation, but how we overcome that challenge is it's going to be more than one conversation for some folks, and that's going to require some patience. But engaging conversation about vaccine hesitation is crucial so that we can reach herd immunity and stop wearing a mask, but also really overcome this virus and continue to build our city from this point. So the data on uptake so far shows the disparities reflect national trends worldwide. It's not just in New York State or New York City. We definitely want to prioritize the eligibility and continue to work with the lack of confidence within communities of color. We want to continue to enhance access. We've heard all the cries about the phone number not working and the vaccine website crashing often. It's still there and I'm offering it. However, I'm also making folks know that if you do have any hardships having access, our healthcare chair, committee chair here, Nye Whitaker, and Marlene can reach out to myself and Padmore John so that we can manage that. So one way we're doing that is while folks are getting tested tomorrow in East Harlem in front of the mass, we're also setting up appointments there. So we'll have 2 teams, one that is to increase outreach on the ground and the other is to do vaccine appointments. And we've been doing that across the board, not just in East Harlem, but Manhattan overall, but especially in our equity communities. We want to continue to build vaccine confidence. So all of you here are trusted messengers. We really need the community leaders to help spread accurate information and help people navigate the process. It's a matter of doing these outreach events, town halls, community conversations, train the trainer sessions, on the ground canvassing, robocalls, mailers, text messages, flyers, palm cards, the commercials. That's really going to be important. The Vaccine Facts video campaign, all of you will have access to this to this presentation. And so you can click on that YouTube to assist, especially for folks who are on the fence, at least give them that for now, if they're not willing to come to any of these community engagement events. And what can you do? The biggest thing here, if you leave with nothing, I would say to continue to practice the 4 core. We do know that masks save lives at the very least. So stay home if you don't feel well, continue to social distance, wear your mask, and wash your hands. And that's really what we're asking from all of you. And that's all I have for now. And I'm willing to take any questions and comments.
I just have one thing, Lorraine, there was, again, reminding everyone, please raise your hand and we'll recognize you for questions. We're technically not taking questions from the chat, but in honor of Ramadan, I know you're going to be tomorrow in East Harlem at the Majiz on East 115th Street. If you could just let them know what time you're going to be there and what the cross streets are, because there was some information in the chat separate from the restaurant workers effort. Tomorrow, test and trace. For their regularly scheduled activities. They have a series every Tuesday called Get Tested Tuesday. I guess tomorrow's Get Vaccinated Tuesday in honor of Ramadan, which is kicking off tomorrow. They'll be at the Majid, and that is where and what time, Lorraine?
Sure, that's at 21 East 115th Street. That's between 5th and Madison Avenue. We'll be there starting testing from 9:30 a.m. to 5:30 p.m.
Awesome.
We'll be right outside.
Thank you. Are there any hands raised, Marlene? I'm going to take questions from the committee first and then from the public. So if you have a question, if you could please raise your hand so that you can be recognized.
Sure, I don't see any hands raised from the committee or the public.
Okay. Thank you, everyone, for letting us interrupt the flow just for a moment. I wanted to catch Lorraine while she was here, and I know we'd missed Padmore, and I really do appreciate that they make time for us. They have several community boards across the 5 boroughs that they're always working with, and they make time to come to us every month. And so I really do appreciate it because knowledge is power. So Lorraine, I'll let you get back to work. Hopefully we'll see you in the neighborhood tomorrow. She'll drop her email into the chat. And please be sure to reach out to her if you need any free PPE. So that's, disposable masks, face shields, hand sanitizers. If you need a testing unit to come to your site, or you want to become a testing site, or if you want to know about your local vaccination options. And again, there's free transportation for seniors, free walk-in for seniors. Please reach out to Lorraine or to our office and we'll get you that information. Get back out there, go save the world.
Thank you.
Sorry for the interruption, and thank you for your patience to the member of the Schwartz Assessment Shelter. So getting us back on track and on topic, the Volunteers of America Schwartz Assessment Shelter is requesting a letter of support regarding the renewal of their contract for the Schwartz Assessment Center with the New York City Department of Homeless Services, which is also referred to as DHS. SAS, which is their acronym, is located at 65 Charles Gay Loop on Wards Island in our district. So if you weren't aware, Wards Island and Randall's Island are part of our assembly district, the 68th Assembly District, and a part of CB11. It is a 335 capacity bed single men's shelter. And as Alvaro stated, the average time that a adult male is there for assessment ranges between 21 and 30 days. So I'm going to first ask if there were any additional questions. I believe the last question was from Eva. So I'm going to ask first, before we go back to any repeat questions, if there's anyone else who is a member of the Health and Human Services Committee who has a question about the type of services, their capacity, history, modalities, outcomes. If there's any other questions first from committee members, if you could please raise your hand. Okay, and then from committee members, I will open up if there's any additional questions, because I don't want anyone to feel like they got interrupted when we had a quick moment to bring Lorraine in from the field. So Eva, were you finished with your line of questioning before we made that momentary shift?
No, I mainly want to ask if there's any, if the resident there have any interest in getting more transportation options, because just going to 125th Street seems a bit limited and your location is actually so close to Queens and Brooklyn.
Right. Ms. Chen, I have your email address, so I would be happy to email to you and we can discuss, if there are any opportunities to cooperate or collaborate somehow. I am part of the member of the bus of the 35 bus. That we discussed, that is the one that provides the services directly from 125th Street to the island. So the different providers, the different shelters, the psychiatric hospital, the fire department, the academy, we have a group that is concerned about transportation. So I would be happy to invite you, you would like to participate, or just to update, with what's going on with that. But yeah, we've been working directly with MTA, to increase the number of buses and services from and to the island.
Thank you. I think that's a great opportunity for follow-up and post-conversation. Last call for members of the committee who would like to ask a question of this facility as we consider a possible letter of support. Okay, I'm going to open it up to the members of the community. If there's a member of the community who would like to ask a question of Volunteers of America and their SAS site, if you could please raise your hand. I think this is the quietest meeting we've ever had in my time since becoming chair. Okay. Marlene, I'm assuming then if there's no questions on the floor that the next step is to take a motion. Is that correct?
Yes, so just you can, Eva put her hand back up. She has a question.
So I'm just struggling a bit how to vote to give letter of support if the main question that people seem to be having concern with loitering and transportation is not addressed, or we don't really see a path forward right now. I mean, I appreciate you directing me to talk to someone else.
Are you talking to me or are you talking to Alvaro, Eva?
I guess both.
Okay, so the way this usually works is there's a presentation, then there's a request for a letter of support, then the letter is written by the, once if it's voted on and approved, then the letter is written by the office of CB11 and distributed. That's usually how the process goes. And Alvaro, I'm not sure, what is the timing? When is this letter due or the deadline for this?
Yes, the RFP with the Department of Homeland Services already was submitted. That was in place. However, again, if we can obtain a letter of support, that would be highly appreciated, just because that will increase, to keep the connections alive, to have this, established relationship with the community board.
And is it usually, Xavier, can I just ask you a quick question? Is it usually common practice that we get to see what the RFP is so that the letter of support is in alignment with whatever the RFP is? This is a question I'm asking to Marlene and to Xavier, who's our vice chair that's on the line.
Typically an RFP is public information.
Okay. Thank you. And Marlene, was there a deadline for our office set for this letter of support that we should be aware of?
No, I wasn't given a deadline when Mr. Salas asked for the letter.
Okay, great. I want to recognize Osendi, who had her hand up.
Yes, thank you. I just wanted to make sure that, we acknowledge all the work and efforts that this organization has been putting forth to address the concerns and issues that we've been having along 125th Street. Unlike other organizations, they actually step beyond their capabilities of providing services. They actually extended beyond, the dismissal of the program for the individual that seeks it, up to 6 months, I believe it was. So it's very important that when we are considering, approving or acknowledge or getting, signing on to this letter of support, that we are aware and that we're taking into consideration all of the work that they've been doing so far, and that we as a community board are here to support them in order to actually develop and fix the issues that we're currently having. So I don't want us to simply stay on one concern or one issue without acknowledging the rest of all the amazing things that this organization is doing.
Thank you, Osendi. And I also want to reiterate the fact, as I have stated in other meetings, that we need to be very mindful of the purpose of the organization. So the purpose of this particular site is to assess. And the only way we will know what treatment is needed, what services are needed, how we can better support those in needing is by assessing them. And so I do think that, this particular shelter has a very particular focus in the services that they provide. And I think that that is an important component of the overall, decision regarding a letter of support. And again, Alvaro, you may have said this before, how many years has that Volunteers of America been running the Schwartz Assessment Shelter here?
1984.
Great, thank you,
I
sir.
was 2 years old. Just kidding.
Thank you. We all needed a little chuckle this evening, so thank you for the humor. So I am going to see if there's any questions one more time from the community. I know it's a rainy Monday night on Zoom. Usually this, like as I said, is a very vocal group, which is why I paused the previous conversation, because I know that this is usually a long conversation when we have these letters of support for this type of service provider, but I don't see any other hands raised. And so I'm actually just going to, Xavier, please, Xavier, the floor is yours.
Yes, thank you. Sorry, I'm keeping the camera off because the kids have been coming in and out and not on their, George literally tried to bring a Thomas the Train and put it on the camera. I apologize. So real quick, with the letter of support, this is your first renewal, is that correct? You're muted.
Sorry. Ms. Armstrong, I don't know if you want, you have more.
No, this wouldn't be the first renewal. Every 5 years, Volunteers of America, the contract goes out for competitive renewal. So since 1984, every 5 years, we have to renew the contract.
Okay, I just wanted to make sure that I had heard that. And again, I apologize because of the interruptions with the little ones, such as the Zoom lifestyle. Okay, so you've been through multiple renewals, and then which is good. And I'd like to, as a recommendation, if there's a way we can continue working together to address the things as we address the issues we've seen in our neighborhood as we emerge from the COVID bubble. I think that's going to be a great concern, having been out in the field since the pandemic broke out. So that would be my first recommendation. But you've been through multiple renewals, which I just want to make sure that that was established on the record. Thank you, and everyone.
Thank you. Do you have a community council or any sort of advisory council or group with the community that we should be aware of? I heard you talk about the M35, because I do think it might also be helpful to incorporate into the letter support that we will be, open to working, more in partnership with the community board so that we can better take care of our residents and those who are coming through our community for your services. So I see you nodding your head. I don't know if Leslie or Alvaro wants to respond. Which one?
Alvaro.
Okay.
Absolutely. We have one. We will be happy for any, or all of you to attend. Right now we're doing like through Zoom, obviously, because the limitations, right? And keeping the distance, which makes things a little more easy for people to participate. Mm-hmm. So we will, who should we send the invitation?
If you could share that information. So just kind of 2 points of follow-ups. One, if you could share the information that you mentioned about this M35 bus committee that is working together. There's a lot of members, not only here in Health and Human Services, but actually more appropriately Public Safety and other committees that might, if they're not already involved, might want to be involved in that conversation. Especially, we've been trying to be sensitive even in Parks and Recreation to the youth that need to use those buses on the corridor, and making sure that they feel safe in doing so, but also making sure, like I said, we take care of everyone who needs to use that route and is accessing the island for services. And then secondly, to be able to make sure that we always have a listing of the calendar, Zoom, call-in, or whatever information for your community advisory council or whatever group you might have that is open for us to learn a little bit more about what you're doing, on a more consistent basis, whether it's monthly or quarterly or annually, so that we can create a stronger dialogue and partnership and collaboration. Because I think one of the things that's happened prior to is so many groups were working in a silo. And then we also have COVID, right, which has separated us. And so, this committee and this current leadership of CB11 is really committed to making sure we rebuild all those bridges and that we are working, holistically, because we know that there may be even greater need coming out of the pandemic. And we want to make sure, that we're prepared for that. So with that being said, I am going to open up the floor for a motion for a letter of support and leave it to the committee members if they would choose to do so. If you could please raise your hand. So I see Osendi first. Osendi, the floor is yours.
I would like to make a motion for the letter of support regarding the renewal contract for SAS with the New York City Department of Homeless Services.
Thank you, Osendi. Is there a second to Osendi's motion? Eva, there's a motion on the floor, so at this point, we have to finish the motion. So are you raising your hand to second the motion? Because we've closed the conversation of question and discussion.
I'm sorry, not to interrupt you. Osendi, do you mind restating the motion? I don't want you all to go to the vote and I have to go back. Restating it and just say it a little slower, please. Thank you.
Absolutely. I am presenting a motion for a letter of support regarding the renewal contract for SAS with the New York City Department of Homeless Services. Is that okay?
Marlene, are you good?
Yeah, I just want to make sure I have her words correct.
Yeah, she just took the first sentence of what's
Yeah.
listed as item A.
Mhm. Yeah, I just want to be clear before this meeting closes that that's what needs to be said. Okay.
So I'm just recognizing Eva, before you speak, I just said that there's a motion on the floor. So are you seconding Osendi's? Because the conversation and Q&A part has now ceased. So I need to move forward with the motion and only call on the person who's seconding the motion. So are you raising to second? Otherwise, I might need you to take your hand down.
I want to suggest a different motion.
So Marlene and Xavier, can I just double check with you for formality? My understanding is that we have to continue with the motion that we have. Is that correct?
Yes, you would continue with the motion that you have now. If the committee votes that motion down, then you can.
Then we can make an amendment, correct?
Right.
Yeah.
So I need.
Parliamentary point of order. Basically, we have a motion before the floor. It has to be seconded. If someone wants to make a quote unquote a friendly amendment and that the original motion culturally as was recommended by the Borough President's office, it can be considered and or accepted by the original motioner, as is customary with our community board. But we do have a motion before the floor. So if a second fails, then something, then a different arrangement. So we have
a friendly amendment then.
Yeah.
Okay, so then let's call for the second and then we can.
You have to call for the second first, Eva. First, I have to see about the second in terms of procedure, and then we can go a second round with any other amendments or changes. So I saw Pastor Isaac Scott with his hand raised next. Isaac,
Yes.
were you raising to do a second on the motion or something else?
Yes, I want to second Osendi's motion.
Okay, so I have a first in Osendi Garcia. I have a second in Isaac Scott. I'm just gonna double check. I see Xavier's hand raised and I saw Robin's hands raised. I was gonna call for a vote on this, but I just want to double check. Robin, are you good? I saw your hand go back down.
So now is a good opportunity to see if the friendly amendment would be accepted versus going through the whole motion for the letter of support. Not. This is the opportunity to hear it. And if the original motioner is accepting of it, then we can present that to the committee.
Okay, so Osendi, I'm just gonna have you just kind of be fully opened ears as I call on Eva, who is stating that she would like to make a friendly amendment to the motion on the floor, which has a first by Osendi and a second by Isaac Scott. Eva, I'm going to ask you, based on what is already written, letter of support regarding the renewal contract for SAS with the New York City Department of Homeless Services, what would be your friendly amendment to that?
I would just want to put a condition for CB11 members to sit on the community boards that we just talked about, the two of them.
On the advisory board, it is, Xavier, let me just double check with you. Do you know, because there are many boards where CB11 can, either has a member that sits on it from executive and or identifies a community member to be on it. Do you know if SAS is one of them, and if so, who?
No, I am not aware of one. This could be an opportunity to make a, sorry, about the
I like
dulcet
comments
tones of,
today. I love
so let me just ask, is there a seat available for, to sit on the cab? That could be provided to the community board?
to Alvaro and his team at the Volunteers of America, is there a seat available for there to be an appointment either of a member of the community board or a resident appointed by the community board?
Absolutely.
Okay.
Okay. So then I would say no, then if that is to be accepted by the original motioner, that the letter of support with the condition of providing a seat for either a member of the community board or a member appointed by the community board to sit on their cab, then, or on that advisory board, then that if that is accepted by Osendi, then we can move forward with the vote.
So Ascendi, I'm just going to call on you again. I know your hand's not raised, but chair's privilege, or is that something that you deem as a friendly amendment to your original motion?
Absolutely.
Great. Does she, Marlene, need to restate that motion?
Yes, just, I got the first part of it, but the amendment that was added, just restate it slowly, please.
The first part was a motion of letter of support regarding the renewal contract for SAS with the New York City Department of Homeless Services, with the condition of providing a seat on the advisory board for the Schwartz Assessment Shelter Volunteers of America.
Okay, thank you.
Thank you.
Do I need to ask for a new second on that, or I?
No, you do not. You do not.
Okay.
You may, the vote may be called.
Great. So Marlene, can you please call a roll call vote on this item or this motion?
Sure. Eva Chan?
Yes.
Yes. Osendi Garcia?
Yes.
Patricia Martin?
Yes.
Jennifer Meyer?
Yes.
Arturo Perez?
Yes.
Xavier Santiago?
Yes.
Isaac Scott?
Yes.
Robin Strachan?
Yes.
Nye Whitaker?
Yes.
Thank you. The motion carries.
Thank you, everyone. Thank you to the staff at Volunteers of America and the Schwartz Assessment Shelter for your flexibility, for your presentation, and for agreeing to create a seat for us so that we can build a stronger partnership. Do you have any other questions for us at this time?
No, thank you.
Thank you.
Sorry, I will just follow in, I guess, with Ms. Pierre, that has been the contact person to you. So we follow with her for the next, for the calendar and other meetings, whatever that will be. Okay.
Yeah, and also for the letter of support once it's approved and ready.
Thank you very much.
Thank you all. Thank you for the work that you do. We look forward to continuing this conversation.
Thank you.
Thank you.
So next up, we have the ICL project, Project Hope. It looks like the presenter is David Matthews. Welcome, David, to talk about services in the district. David, you will have 10 minutes on the agenda. Is David here?
Yes, David is here. I'm hoping he's still here. Hold on. He was here. I don't see him. Just give me a second. He was here at the beginning of the meeting. I'm not sure what happened. Maybe he lost service.
That's okay. I'm gonna, if you don't mind, take a little chair's privilege to move forward on the agenda. I don't know if you have a phone number or email if you want to touch base with him.
And then we can always have him come to the next meeting if he's available. Okay. And we do know it's a rainy day, so some of the service has been in and out for people. So I want to move forward and turn over the floor to Xavier. Xavier asked us to add this under old business. Xavier, I didn't know if you wanted to start and then I would chime in on this particular item.
That's fine. If I could share my screen, that would be great. It's going to be a very simple Google sheet. It's in our human services working, what we call our sandbox. At the risk, please excuse me if any of my kids run in here. Hopefully they will not.
As long as they have clothes on, it's fine.
Yeah, sure. So let's move along. If I could share my screen, please. Beautiful. Oh, what is going on here? Why can't? Well, it's not trying to. Give me just a moment. I can't even. It's not even showing. Okay, tell you what I'm going to do. I apologize because I'm going to share this with Marlene real quick. Marlene, I apologize because for whatever reason, my other computer is having an issue with sharing. And
that's fine.
You should have it in a tick. It's been shared with you. So if you can see that.
Okay, let me go to my email.
Okay, so little background is Marlene grabs this. It's a proposed kind of form for continuing our conversations with engaging with our providers. It's what was used previously by NIE during our initial outreach. For those as a quick backdrop, we had passed a reso dealing with a pause, if you will, for no new clinics, especially methadone and whatnot, while we try to assess how many providers we have, what they're doing, what the percentiles are. And there was initial outreach back in December and January where there was a general list of questions. And part of our earlier discussion was about creating a simple form they could fill out. So what I have done is I've just basically put it in a Google sheet, and it's a form they can fill out straight away before they come to attend. And we will be engaging many of our providers, and this will give us the information right away so that when we have them attend, thank you very much, Marlene, they can have all of this information answered. It's therefore on the public record, and we can engage in a more productive dialogue. So this really here is to show that there's the ball is kind of moving down the field. This is not necessarily to present to get into the weeds tonight, but it's been saved in our sandbox, so you should be able to all see it from our community board membership on this committee. And this will allow us to see if there's any other issues that are questions we want to add to it. There are 23 questions, including what the name of the org, website, presenter. As you can all see on the screen, location in East Harlem, years, the organization status, non-for-profit versus profit, background on funders, authorizers, capacity, et cetera, and so on. And it gives us more of a clinical perspective on their servicing to our community. And that will allow us to further make a formal inquiry as to whether or not they are truly providing the resources we have requested over the years. So this is kind of more of to wet your palate, take a look. If there's something you think we should rephrase, if there's something you think we should add, please take a closer examination so we can vet it between this month's meeting and next. And so that's really it. Nye, if there's anything you'd like to add.
Yeah, I just wanted to make sure that we shared this because I know many of us have been having conversations. Back when I started on as chair, some of us reached out to different organizations on our own, and we wanted to make sure that this was shared publicly because we've all been asking these questions. We wanted to have one sheet where all those questions were in a consistent place because everyone asked the same thing, right? We asked what's the percentage of East Harlem, people do you serve? Do you have sites in other locations? What is your security plan? What measures and outcomes do you have? So this was just a form or sheet where we were collecting all of that data. We've been having discussions as to whether or not we should turn it into some sort of Google sheet that would make it easy for people to share, that every time someone comes as part of our agenda, when you know that a new group is coming in, an organization in this space is coming to present, we would have this information in front of us. And also, please want to encourage everyone in the committee, if you have other questions to add to this, please do. We want to make sure that we're comprehensive, but also that we're keeping a thorough record of the organizations that come in front of us, their answers to these questions, and that we're being consistent in our research. Because as we said, we're asking for a pause for a certain amount of time. And in that time, we need to do our due diligence to bring as many organizations in front of this committee and our larger board as possible, so that we can start to understand the complexities of the work that they do, whatever challenges they're having, who they serve, how we can better partner to make sure that those in our community are a priority for service, and that we're all being good neighbors. And so I just wanted to make sure that this was transparent and available to everyone. I thank you, Xavier, for throwing it into the shared drive. And we will continue to refer to these questions every time a presenter comes. I want to acknowledge that Robin has her hand raised. Oh, you're on mute, my sister.
Duh, thank you. I think it's a very thoughtful list, but since it's so thorough, I would like to suggest two other things. One of which is a list of board members, and the other is in terms of income. Can they tell us how much is contractual versus other kinds of donations, such as foundations, donors, etc.?
Yeah, so I had that on for funders, which is a little bit rounder. So I think maybe if we can have that as a sub under funders, because I think that's important to know, like, are they state funded, city funded,
right.
What's the reimbursement?
Are they only relying on city contracts,
Right, exactly. And so I do think that that's important. And then I also wanted to add something for services, because I know you've talked about this before, and we've had a conversation as to whether or not they're offering telehealth services, because you've mentioned before, as other groups have mentioned, I know CCHP mentioned that they don't get the same reimbursement for telehealth services. And I know that that's been a burden to figure out getting tablets and getting Wi-Fi and training people and all of those other, having a maintenance contract on the tablet. I was speaking to a service provider yesterday in our district who said she's had a lot of seniors drop and break. They're so afraid of the tablets that, they've had already issues where they've dropped them or they've broken them in some way. And then they have to have like a maintenance or service plan of extras. I think telehealth services is another component that we need to address. Eva, I saw your hand raised.
Can you show the other questions? I was wondering if there any audit report from Oasis.
So in the larger
findings from audit report.
So you're talking about in our larger moratorium, we have a whole section that asks for a bunch of other stuff, which we can compare and contrast this list to that list from the moratorium.
Oh, no. I think that's the only thing I'm asking. I think it's part of 14 already.
Okay.
Complaints or issues. I just want to clarify that any findings from audit.
Yeah, perfect.
Should be listed.
Thank you.
Okay, and thank you again, Eva, for prompting everything as a reminder. But yeah, I just added those items. So thank you. They should be showing up there live.
Great. So again, this is here as part of old business. It'll be something that we can refer to every time we have a service provider come. We will ask them, to fill this out in advance. We are thinking about whether it should be a Google form or an Excel spreadsheet, just something that would be easy for people to use and share. And again, we'll continue to fine tune this process. So if there are any other questions from the committee and or the public on this, if not, we're going to move forward to the next agenda item. Marlene, can I ask you to move forward to the next agenda item?
Sure.
Xavier, you're welcome to unchair. Oh, she's got you.
One second.
No worries, take your time. Look at everybody, we're almost done. Look at Robin with the thumbs up.
I'm sorry, thank you
No,
guys.
it's okay, take your time, Marlene.
New business?
Okay, I've been having, everybody's having warp stuff with the rain. Once it rains, it just seems it changes the Zoom experience. So I'm just gonna ask if there's any new business from any of the board, the committee members that are with us. If so, please raise your hand. I don't see anything. Next slide. Then I think we're adjourned. So I'm going to ask for a motion to adjourn by raise of hand by a committee member. Okay, I see Robin and then Eva. So I'm going to take Robin first and then Eva.
I move to adjourn. Thank you.
I knew it would be. I say that with love. I was like, I know Robin's going to be ecstatic. Eva, I'm calling on you next, my sister. Are you seconding that motion?
Yes, I second.
Okay, so I recognize Robin with the first motion and Eva with the second. I'm going to ask Marlene for a roll call vote.
You could do this by acclamation.
I can. That makes it
Yes.
even better. So I'm assuming, but I'm going to start with this. Are there any objections to us adjourning? Okay. All in favor?
Aye.
Any abstentions? Okay, I think we're adjourned. I thank you all for your patience and flexibility and for the great work you continue to do on behalf of our community. And we will see you all next month.
Be well.
Be well, all.
Stay
Thank you very
healthy
much.
and
Take
safe,
care,
everyone.
everyone.
Stay
Thank you.
healthy and safe.
Thank you, everybody. Have a good night.
Night, night.